I'm going to start off by checking my orders. So here it says our orders are to give a peripheral IV and start a saline lock on this patient. So I'm going to make sure I have all my stuff that I need first. My lock, IV start kit, saline, and needle. And I'm going to bring those into the room. Make sure everything is good to go. No holes or anything. All right. Knock, knock, knock.
Hello.
Hello. How are you today?
I'm good. How are you?
I'm doing great. So my name is Devin, and I'm going to be your nurse today. I'm going to be starting a peripheral IV in your arm. And if that's all right with you. And what this is it's going to be a saline lock. So we will insert the IV and then put a kind of a tubing, a cannula on it to be able to administer medications easier. Does that sound all right with you?
Yes.
All right, awesome. And can I confirm your name and date of birth?
Yes. Ivy Armstrong, born March 9th, 1964.
All right. And is it all right if we use your right arm?
Yes.
All right. And you don't have anything wrong with this arm? You don't have any problems or anything, right?
No.
All right. I'm going to start by cleaning off your bedside table. Is it all right if I use this?
Yes.
Awesome. Get some cabbie wipes. Make sure our workstation's all clean. Alright. I'm going to bring my supplies over here. And I'm going to draw our curtain to give us some privacy. And is it alright if I move your bed up?
Yes.
Alright. And we have it locked. So I'm going to adjust it to the correct height that I need to work. Alright. So have you had one of these IVs done before?
No, this is my first time.
All right. Have you been stuck with a needle before?
No, I haven't.
All right. Well, it's going to be a little uncomfortable. Do you want me to tell you when I stick you, or do you want it to be a surprise?
You can surprise me.
All right. So I'm going to start by looking for a vein here. I'm going to put this tourniquet on. So this is going to occlude your arm, so it makes it easier for me to see your veins. They're going to pop out a little bit for me.
Okay.
All right. And this one here looks good. So I'm going to sterilize the area next with our chloroprep. There we go. And for 30 seconds, 29:30.
Take off my gloves, do hand hygiene. Grabbing this. Grabbing this. Grabbing this. And I'm laying my syringe with my patient name. And the medication. That is all I need. No, I don't. I need savings. I need 2 savings. I need to run that up for the video, so I'm using this one as 2. Okay.
Good. I'm gonna turn on these lights here. And can you tell me your name and
Okay, good. I'm gonna enter the room and set myself on
perfect. Any allergies?
And
And is it alright if I set my equipment here?
Oh, yes, that's fine.
Awesome.
It's Nurse Andy, and then it's Nurse Andy, and then can I get your name and date of birth? And you have any allergies? Okay, perfect. And then
And I meant to ask you, do you have any allergies to anything?
I do not.
Awesome.
I am back with your medication.
Alright.
20 milligrams of
Well, we're not giving any medication, so right now at least.
And I am going to be giving that here for your IV here for your high blood pressure. Does that sound good?
Okay, now that that area is dry, I'm going to occlude the area.
You know what? This is looking really good. I don't see any bubbling. And leaking. Feels pretty good.
Get that really tight.
Looks good to me.
All right.
So now, hand hygiene. Hand hygiene, new gloves.
Okay.
No. No, I didn't. Theoretically, I would have been told this. Hold on. Okay. So now, I'm gonna have different alcohol.
Okay, and I have return.
Alright, so Ivy, I am going to start by getting this area to do
Okay.
which it's like back to back. You don't really have to do that because alcohol wipes. 40 seconds.
All right.
30. Roll away.
Let's get this cleaned up a little bit.
Aspirate a little bit. Get this in the
Okay.
Yeah? Okay. I think it's hard to see because the
All
background
right,
is bright.
and gonna aspirate it. Make sure we got a good connection.
So then,
I'm gonna adjust this tape a little bit.
pull from the top.
Make sure we got a.
No, I don't need
Okay. And it looks like we got some aspiration here. And then I'm gonna flush with 2 milliliters.
Then the alcohol wipes. Over the course of 1 year.
Okay.
Oh, that makes sense. Thank you. I learned it very quickly though, the program Right. It was like a crash course. Yeah. Cheetah. This is my first one. Okay, and then
All right. How do you feel?
I feel fine.
All right. Awesome. And I'm checking the site to make sure there's no reactions.
throw away.
And we're looking good.
Second feeling.
So I want you to let me know if you have any itching or burning or a rash to the area. Let me know immediately, okay?
Okay.
And we'll get that sorted out. Okay, I'm gonna clean up now.
And then unhook it. And then throw away.
This goes in our sharps container.
Whole time I'm making sure it smells good. Does look good. But I didn't even lock it during the last Yeah. The last.
All right, and I'm gonna lower you back down.
So there's your medicine. How are you feeling? And then take your gloves off.
All right.
New gloves.
I'm gonna go check over your order set and I'll be back. I believe we're giving you some furosemide for some of that swelling that you're having, all right? Is there anything else you need right now?
No, not right now.
All right.
Okay, and while I'm cleaning up, I am still washing.
And hand sanitizer. All right.
Gloves on. Clean the table. Gloves off. Hand hygiene again.
So I'm gonna check our order set again. And it looks like we need 20 milligrams of furosemide via IV push. So what I'm gonna do is I'm gonna draw up 1 milliliter since it's 20 milligrams per milliliter. So I need 1 milliliter.
Are you ready to record?
So I'm going to make sure I have all my equipment. I got my medication from the Pyxis and I double checked that it's 20 milligrams per milliliter. And this is for Miss Ivy Armstrong for swelling. All right. So next I'm going to draw out my medication. Tight. Okay. And I clean my area, my file for 30 seconds. 28, 29, 30. And for 1 milliliter of air. I'm gonna push the air in first. And then drop. One mil. Back onto the desk. This one's actually upside down. Okay. This is gonna be on the sharks. In the bedroom.
I appreciate you correcting me. Thank you. Please correct me.
And then I'm gonna cap it. And then after it's capped, I'm going to put the patient medication, patient name, date of birth, and then the medication dose and amount, and who it's for, and route, which is IV push.
I've used this I've used this 2 times now. It is bendy now. Okay.
So I'm gonna grab the rest of my equipment that I need. I'm gonna grab an extra flush.
Oh, okay. And then the cap as well, just the whole thing.
Okay. Now I have all my equipment. And I'm gonna put the medication back in fixes.
Okay.
And I'm gonna go back in.
Okay.
Thank you.
Knock knock.
Hello.
Hello. Hi Ivy. It's
Hi.
me again.
Hi.
How you been doing?
Good.
Awesome. So, we're going to use these gloves and hand hygiene. These gloves on as well. How have you been?
Oh, still here.
Yeah. So I know you just told me, but can you confirm your name and date of birth for me?
Yes, my name is Ivy Armstrong, and I was born March 9th, 1964.
Okay, awesome. That matches your armband. So here I have your medications for you, which is furosemide, 20 milligrams in 1 milliliter. So I'm going to be giving you 1 milliliter of this medication into your IV site we just set up. Does that sound all right to you?
Yes.
And this is for your swelling that you've been have going on.
Okay.
Okay, awesome. And I'm gonna put this down. And I'm gonna scoot your bed up. Is that all right?
Yes.
Okay, we have it locked, so no worries there.
Using needles too? Using new needles for the video?
Okay. Sorry if I used your bedside again.
Yes.
I totally saw what you were talking about. My brain was just not. Okay.
Well, it's something you also want to do.
So I'm going to sterilize this for 30 seconds. 28, 29, 30. And I'm taking the lock off. And we're going to start with a flush. All right. Looks like you're kinked here. Okay, so I'm gonna start by flushing this. A couple mils of water, or sorry, saline solution, not water. Okay, good to go. Next, I'm going to take your medication that we have for you. set that down. I'll get a new one. All right. Gonna inject your medication now. Over the amount of time we need to. Okay. Sterilize this again for 30 seconds.
That's okay.
And then finally one more flush to make sure all that medication gets where it needs to go. And I'm gonna do this slowly as well. And how are you feeling?
I feel great.
Okay, that's good. So if you feel anything else other than great, please let me know.
Okay.
Okay. We're good to go. Your site still looks great. I'm gonna clean up. Okay. Inspecting the site. You don't have any tenderness or anything here in your
No.
arm?
Nope.
Awesome. That's what we like to hear. So I'm gonna lower you back down.
Okay.
Put this back up. All right. Is there anything else I can get for you?
No, I think I'm good.
Awesome. All right. You have your call light, so just let me know if you need anything. Feel free to ring that, especially if you feel any different than normally, okay?
Okay, thank you.
All right.